So let's exit out of the mouth, head into the throat or the pharynx here, and we're going to make our way down into the stomach tonight and probably some of the small intestine. All right. So again, we've talked about the pharynx before when we were talking about the respiratory system. Okay. It is a funnel-shaped passageway, all right, for both food and, all right, liquid and air. Okay. So obviously we're going to be focusing on the food and liquid portion here. And the pharynx, especially when we start to get down into the towards the esophagus, we are going to see that there are 3 different types of muscles, all right, and more importantly, they're skeletal muscles, which means they're under voluntary control. All right, so we call those the pharyngeal constrictor muscles, superior, middle, and inferior here. On top of that muscle tissue, it is going to be, all right, covered by our non-keratinized stratified squamous epithelium. Again, we're going to find non-keratinized stratified squamous epithelium in areas that are going to have moisture located nearby. So obviously, we're going to see it in our throat, the posterior portion of the oral cavity there. All right, and we know since it's stratified, number 1, mechanical stressors. So abrasion from food. All right, when you're chewing and then forming that food bolus, all right, that food has to travel down, all right, into the oral pharynx there and down the esophagus. So it's going to be exposed to those abrasive forces. So that tissue, that epithelium, needs to be able to handle that. Okay. So from the pharynx, then we're going to enter into the esophagus. Now the esophagus, and there's a couple things here you need to understand. Normally, as long as you're not, obviously using it, it is not patent, not like the trachea. It doesn't have those C-ring cartilages around it, so it's normally collapsed. Right? It starts at the level of the cricoid cartilage. So if you know where your thyroid cartilage is, just go inferior to that. That's going to be where the cricoid cartilage is, and that's where we're going to see it begin. It is anterior to your spine, but it's posterior to the trachea. All right, so it's going to sit behind, all right, your windpipe there. All right, and it's going to be the structure that is going to connect the pharynx to the stomach. So you're going to see it travel down through the thoracic cavity, pierce through the diaphragm, through the esophageal hiatus there, and then it's going to enter into the stomach. Now the stomach sits just inferior below the diaphragm, and you have about a centimeter and a half of the esophagus that is present between the inferior portion of the diaphragm and the stomach there. And this area here is a highly prone area for what we call a hiatal hernia. And I'll show you on my picture what that is. The hiatal hernia is when the fundus here in this kind of region of the stomach pokes up through the esophageal hiatus here. And it can cause food material to get trapped. Some of the symptoms of a hiatal hernia, aside from some pain, is the frequent regurgitation of ingested materials there. So your esophagus has a sphincter at the top of it and a sphincter at the bottom of it. And the sphincter at the top, when you are not eating, right, normally these sphincters are closed, okay? But especially this sphincter is closed because it prevents, all right, air from entering into the stomach, okay? And I know there's some cases in which that you've had maybe when you're swallowing food, but at the same time you inhale at an inopportune time, okay? Now, I don't want you to think that if you're inhaling that food is going to enter into, or the air is going to enter into the stomach. It's not necessarily going to happen. You can't help but swallow some, because when you're breathing in, all right, your digestive center in your brain prevents air from entering into the stomach. But what also helps to prevent air from entering into the stomach is going to be these two sphincters here, okay? The inferior one is just going to be at the inferior portion of the esophagus. And the common misconception with the inferior esophageal sphincter is that it prevents the regurgitation of ingested materials. It does not. All right, it plays a minor role, okay, but people that have GERD or gastroesophageal reflux disease, it's not because of the inferior esophageal sphincter. It can be compromised, but it's also the diaphragm muscle there that helps to prevent material from the stomach going back up into the esophagus there. Mainly the diaphragm is going to offer most of the assistance there. All right, the inferior esophageal sphincter, does not provide a lot of prevention of regurgitation. So this should look familiar to you from 210, and all these structures should already be labeled. And if not, we'll just quickly run through them here. Okay. 13 here, here's the esophagus, which leads into the stomach. Okay. And then just on the right side here of your body, opposite the stomach on the left, all right, you have the liver, largest internal organ. All right, just below it, this little green glob, that's going to be the gallbladder. All right, then you have your first portion of your small intestine is the duodenum here. And then sitting in between the duodenum and the spleen is the pancreas here. That is another accessory organ. All right, we talked about it in its role with the production as an endocrine gland for glucagon and insulin. We're now going to talk about some of its digestive enzymes that it's going to produce here. But it's sandwiched in between the duodenum and the spleen. You can see right below it, here is part of the large intestine, specifically the transverse colon. And you can see more of the small intestine, okay? Over here in this region, you can see, well, we'll get down to the specifics, but this is going to be the jejunum and then the ileum. Right, and then down here, you'll have the rectum, and then finally the anus there. All right, so when we get into the esophagus, primarily it is, again, lined with that non-keratinized stratified squamous epithelium. All right, the mucosal layer, the innermost layer that's adjacent to the lumen, is going to be that non-keratinized stratified squamous epithelium. Just below that, remember, when we get into the digestive system, we're talking about normally 4 layers: the mucosa, the submucosa, all right, the muscularis layer, and then the outer layer, the adventitia, also known as the serosa. All right. When we talk about the submucosa, in this case, we're going to be dealing with tons of our elastic fibers. Those protein fibers, as you can probably figure out, all right, will allow the accommodation of food to travel down through the lumen of the esophagus, all right, as the muscles are contracting and relaxing to provide for the movement there. But this also allows for the distension here of the esophagus as food is traveling down through there. And at the same time, we're going to see that this area of the esophagus is going to be loaded, okay, with several glands. One, producing lubrication secretions to help ease the passage of food as it's traveling, all right, from the pharynx down into the esophagus. The muscularis layer has 2 layers of skeletal muscle. Okay, so that means that there's a voluntary component there. All right, but this is only seen in the superior 1/3 of the esophagus. Okay, we divide the esophagus into thirds. The superior 1/3 is going to be primarily skeletal muscle. The middle 1/3, we're going to see a mixture of skeletal muscle and smooth muscle. So we're going to start to transition from the voluntary muscle tissue, okay, skeletal, we're going to transition into smooth. And then the inferior 1/3 is primarily smooth muscle, okay? And then the outermost layer, that's the adventitia, all right, that is going to be also known as the serosa, okay? All right, so let's talk about swallowing. There's going to be 3 phases to swallowing here. All right, another name for swallowing is deglutination here. Okay, and basically, all right, we're going to chew some material up, and we're going to form a bolus, and then that bolus, which is formed in the oral cavity, is then going to travel from the oral cavity down into the stomach. So the first phase is the voluntary phase. All right, this is pretty much, all right, when you're chewing on the food, okay, manipulating that food with your tongue. All right, all of that is controlled by the cerebral cortex. Pretty much, your primary, your frontal, the premotor cortex there, all right, in the frontal lobe. Okay, this is where we're going to see, all right, the actual deconstruction, the mashing up of the food, breaking something into smaller bits, coating it with saliva, all right, as the saliva is being secreted, and then mixing all of that up, and then eventually swallowing it or moving that food into the oral pharynx here. All right, which moves us into the next phase, the pharyngeal phase, primarily an involuntary reflex here. All right, we talked about the fauces. All right, those are those openings that lead into the pharynx here. So in this situation, we're going to be stimulating the medulla oblongata and the brainstem there, all right, the swallowing center, to initiate that reflex, all right, and transitioning that bolus of food to travel down the esophagus. And we're going to see, all right, the alternating contraction, relaxation of the muscles, all right, which are going to be our effector organs to help transition that food down towards the stomach. So when we're talking about the effector response here, all right, as you're chewing on the food and you're moving it towards the oral pharynx, that's going to push the soft palate, the uvula, all right, up against the roof of your mouth to help prevent regurgitation of any materials up into the nasal cavity there, okay? And then at the same time, we're going to see the extrinsic muscles of the larynx. That is going to help elevate and move the epiglottis, all right, that flap-like structure, all right, and that's going to move it down, all right, to cover the opening, the glottis there for the trachea, okay? And so that prevents any food from getting down into your respiratory system, all right? Again, all this is occurring here in the medulla oblongata. And while at the same time as the epiglottis transitions and moves down over the top of the glottis there, all right, we pretty much, for a moment, inhibit the respiratory center, all right, to prevent you from taking a breath while all this is going on, all right? Because again, we don't want to take make the mistake of ingesting anything into your conducting zone of your respiratory system. Which leads us into the final phase, which is the esophageal phase. Again, involuntary phase. We're just pretty much moving, all right, that digested, or not digested, but that bolus down into the esophagus. And this is where we're going to see that alternating contraction, relaxation process that is going to move the bolus down into the stomach. Now, during this time, all right, the receptors there in the esophagus are going to cause a relaxation of both the superior and inferior esophageal sphincters, all right, so we can allow the passage of that bolus, all right. But once you're done chewing, okay, and that bolus moves down, then those sphincters will then engage again, all right, to prevent any materials from moving back up towards the oral pharynx there, all right. We do not want any regurgitation of material. Which leads us into our next digestive structure, stomach, okay? So the stomach, to me, you know, I know it's described as a J-shaped organ, but it looks kind of like a bean sitting on its side. This is a horrible drawing here. I apologize. All right. So you have two curvatures, all right? The big curvature here, that is going to be the greater curvature. The smaller one here is going to be the lesser curvature. All right, and we have four parts to our stomach. The cardia, which is basically this region here. All right. Then you've got the fundus, which is this kind of little bump at the top. And then the body, and then the pyloric area there. All right. So food first enters into, all right, the cardia here. All right. And then it's going to just kind of fall into the stomach and then spend a lot of its time there in the body of the stomach. Okay. The last portion, the pylorus, all right, that is where the stomach starts to taper down, all right, into this region here, preparing it to leave the stomach, and it's going to enter into the first portion of your small intestine, of the duodenum here. So cardia is the immediate area. Once food enters into the stomach from the esophagus, this little kind of dome-like structure here, there's the fundus. Most of the time, the fundus will have air in that region there. You can see it on x-rays. They call it a meganblossom on the x-rays, and you'll see this air trapped in there. And then the body is this region right here. Okay, we see a lot of mixing and secretions occurring. We'll talk some about that. And then the last region is the pylorus there. Okay, whoops. There we go. So in the pylorus, again, all right, to prevent the passage of material from leaving the stomach, all right, because when the food enters, when the bolus enters into the stomach, we start to mix it up with some of the gastric secretions. And at that point, then we rename that food material, we call it chyme, right? And so we're going to be mixing that food material up with some of the digestive enzymes, all right, that are going to help to break down. We'll talk more about that in the lecture portion, about which enzymes specifically we'll find there. But to prevent the chyme from leaving, all right, the stomach, all right, we have the pyloric sphincter here, which, all right, is mainly going to be closed until certain hormone secretions, all right, and certain nervous signals, all right, from the digestive center there up in your brain are signaled for it to open up to allow the passage of that food. But for the most part, that pyloric sphincter, all right, is going to stay contracted and prevent any movement. Now, last semester in 210, when you were labeling parts of the stomach there, you saw that the stomach had these folds in it. We call those rugae, okay? And part of these rugae, they'll help to increase the digestive surface area, all right? But when you start to put food into the stomach, it'll stretch out. So when the stomach is relatively empty, you'll see these folds in there. As it stretches out, all right, these rugae will start to slowly kind of disappear, all right, as they're accommodating for the space from all that food that enters into the stomach there. So here, if you have your atlas, we can see a couple of these regions here. All right, so here's the esophagus coming down into the stomach. All right, you have your cardiac sphincter. All right, that's the sphincter closest to the cardiac region here. Food enters into the cardia. Here is the fundus, this dome-like structure over here. All right, the majority, the largest part of the stomach is the body. You can see the rugae, the folds. We have our greater curvature here, lesser curvature over here. And then the pylorus, as the stomach starts to kind of assume this funnel-like configuration, all right, towards the exit of the stomach, and that's going to be the pylorus here. And then we have the pyloric sphincter. All right, that's that sphincter that will remain closed until it's time to release the chyme into the small intestine, into the duodenum. All right, so primarily the stomach is lined by our simple columnar epithelium. All right, and so simple epithelium primarily has a secretory role when we're talking about the digestive system here. And that epithelium is going to sit on top of the lamina propria. All right, and you're going to see, all right, in this columnar epithelium, these little deep pits that go down. All right, these invaginations here, okay? And those are referred to as the gastric pits. And it's obviously going to be lined by the simple columnar epithelium, but you're going to see at the bottom we're going to have, all right, these gastric glands. And to really kind of give you an appreciation here, all right, because at the base of the pit, all right, you know, you'll have your epithelium, but you'll have the gastric glands that are pretty far away. And so these glands are going to produce a lot of your digestion enzymes, but it's tough to get those secretions up here. Well, not to worry, because of the muscularis mucosae here, they're going to help, all right, to move some of those secretions up into the pits. Let me show you what I'm talking about. All right, so here you can see the gastric pit here, but a lot of these glands are relatively far away, okay? So this layer, all right, of the mucosa sits on top of this smooth muscle. And this smooth muscle, when it contracts, it'll push a lot of the secretions from these gastric glands up here into the gastric pits. And then it will help to move some of that material out into the lumen here. Did I skip? Yeah, okay. The next layer here, okay, right after we get from the mucosa there and the submucosa, we have our layer of the muscularis layer. Now, here's an interesting fact about this. There are 3 layers. Normally we see 2, but there are 3 layers of smooth muscle. All right, because normally you'll have the 2 layers that are perpendicular to one another, and it provides for that process of called peristalsis, in which we get that alternating period of contraction and relaxation, which allows food to move from the beginning of the digestive tract, or at least in the small intestine, towards the anus there. And in this case, with the stomach, all right, it is going to help with that process, but we have a 3rd layer there to help churn. Think of the stomach as a big cement mixer, those trucks that you see driving around. All right, and that's what we're going to see here. All of these layers, the inner oblique, the middle circular, and the outer longitudinal, all right, because of the angles that they lie to one another, are going to really promote that mixing, churning, blending of the material that is inside, all right, the body of the stomach there. Okay, and our outermost layer, that's serosa or adventitia, all right, that is going to be made up of the visceral peritoneum. So here you can see, all right, all these layers. The innermost layer, the mucosa, all right, lined with the epithelial cells, and beneath the epithelial cells, we'll see the lamina propria. All right, and then we follow that with that muscularis mucosae there. It will help to eject or move some of those secretions into the gastric pits. The submucosa, then that's where we're going to see all our blood vessels, because again, as we're digesting this material, we need to have those nutrients or those substances that, all right, that we're digesting diffuse across and eventually get into the bloodstream. That's our goal, is to get this material into the bloodstream and circulate it throughout the body. Well, those blood vessels, all right, the arteries and veins are going to be located in this layer, but also the lymphatic vessels, all right? So we're going to see lymphatic vessels, all right, because those two, we'll talk later on about that, all right, how for the lymphatic vessels, a lot of the fatty elements are going to move into the lymphatic vessels. 3rd layer is the muscularis layer. That's going to have all 3 of those layers there, all right, at different angles to one another. And then finally, the outermost layer, the serosa there, which is pretty much going to be made up of the visceral peritoneum, all right, on the outside of the stomach. We'll get into this part here in a little bit more detail in lecture, okay? But just to kind of let you know, there are 3 phases here when we're talking about regulation of the digestive processes for the stomach. So the first one here is, you probably heard of the term, it's all in your head before. Well, literally, that's what happens. We talk about the cephalic phase of digestion, all right? So what will happen is, if you start to see something, well, I should say something, see food, if you think about food, you will start the cephalic phase. You smell food. And I'll go as so far as to say, if you were to be in your living room and you hear somebody in your kitchen cutting things, chopping up food, you can start this phase right here. So it all starts up here, all right, in the cerebral cortex, and that cerebral cortex will then stimulate, all right, the digestion centers in the medulla oblongata to stimulate the vagus nerve to send signals down to the stomach. Now, this can start to occur without you even putting any food in your mouth whatsoever, all right? It'll start the stomach to start to increase gastric secretions. It's getting itself ready for food to enter in. And those muscles that you saw, or those 3 layers of muscles, will start the churning process, start to mix up those gastric secretions here. So that's all in the cephalic phase. All right, then we have the gastric phase, where you've been eating food, the food's gone down into the stomach, so you actually have the actual presence of food here. All right, and so the presence of food, you have baroreceptors in the stomach wall. And those baroreceptors sense stretch. And so there's a stretch on the wall there. It sends, all right, nerve signals up to the into the digestive center here in the medulla oblongata, in the brainstem there, that will then trigger, all right, the vagus nerve to stimulate the cells in the stomach to increase more secretions, okay? and to start increasing the contractions of those muscles so we can start to mix all this up. All right? And then you have cells in the stomach that release a hormone called gastrin. And that gastrin will also, so it's like a positive feedback type of mechanism, that gastrin will also then increase, all right, more secretions and the rate of the contraction for those muscles to continue on with the churning and mixing of all that food. The last phase here, all right, is the intestinal phase, in which we're going to start to empty the stomach out, okay? So what will happen is, all right, the stomach now starts to empty its contents into the small intestine. You have these chemoreceptors in the small intestine, all right, that detect the chyme that came in from the stomach, all right? And as that occurs, all right, you'll see the release of these two hormones called cholecystokinin or CCK and secretin. And what they'll do is they'll decrease the rate of contractions or the force of contractions and the amount of gastric secretions because the stomach is now empty. All right, now that there's no more food or chyme in the stomach, all right, the signals, the baroreceptors decrease their information to the brainstem, and then therefore the brainstem no longer triggers the vagus nerve, all right, to send its information for contractions of the muscles in the stomach or secretions of the cells there in the stomach. We'll get into this more in detail in when we get to lecture. All right. Well, let's jump into the next portion here of the digestive tract. All right, and we're going to talk about the lower gastrointestinal tract. We're going to start off with the small intestine. All right, small intestine has three divisions: the duodenum, the jejunum, and the ileum. The duodenum is most proximal. The ileum is the most distal portion here. Now, we do consider the duodenum still part of the upper GI tract. There are four parts to the duodenum. Okay, the first part of the duodenum is considered to be what we call retroperitoneal. All right, so that's going to be behind the peritoneum. All right, but the last three parts are going to be what we call intraperitoneal. All right, so we're going to see a lot of digestion, or what we call chemical digestion, when we start to break down, all right, proteins like into amino acids and things of that nature. And we're going to start to see a significant amount of absorption of those nutrients across, all right, the digestion wall there. But also, okay, remember the digestive tract has accessory organs like the liver, all right, the gallbladder, and the pancreas. Well, those three accessory organs are all going to dump their secretions right here into the duodenum so it can mix up, all right, whatever was mixed up in the stomach already, that chyme. Now we're going to increase some more digestion of some of those contents here in the duodenum. All right. So we'll see the three the three organs: the liver, gallbladder, and the pancreas. All of those secretions, primarily bile from the liver. The liver's primary function. I mean, it has a lot of functions. The liver does a lot. All right. But for the GI tract, its primary function is to produce bile. Bile is going to help with fat breakdown, okay? And so actually what will happen is the liver produces the bile, ships it off to the gallbladder, where the gallbladder will store it, all right, and it concentrates. That's why if you get a gallbladder removal, all right, yeah, it's going to affect your digestion, okay? You can't eat fatty foods and handle those as well as you used to be able to. And you might find that you can no longer, you become much more aware of where the bathroom is, let's just say, especially after fatty meals, because within about half an hour, if you have a fatty meal, you will be in the lavatory, all right? Because the bile that's produced comes directly from the liver. It's not concentrated, all right? So it's going to come right from the liver, and it doesn't get regulated as well. Okay, we'll talk about the different types of digestive pancreatic juice enzymes when we get into lecture. The next part of the intestines, all right, is going to be the large intestine. Its primary job is going to be to start to take digestive components and start to make something that's liquidy into something that's more solid. So it's going to absorb primarily mainly water and the electrolytes and some of our fat-soluble vitamins through that area. So its main focus is to actually start to produce feces. All right. So keep in mind, all right, a lot of digestion still occurs in the large intestine, but a significant amount of digestion occurs in the small intestine. All right. And so as we start to move food products further and further through our digestive system, all right, the digestive system is going to try to take advantage of that material in which it has and try to extract as much of the nutritional value from those products. But as we get closer to the large intestine, a lot of that's already been done. All right, so here you can see, all right, the stomach's not listed here, but you can see the liver here on the right, pancreas is right here in the middle, and here's that duodenum, that first part of the small intestine. All right, and then you can see the jejunum is mainly on the left, all right, quadrant over here, and then our ileum is over here, central and over towards the right. And the ileum will attach onto the cecum here of the large intestine. All right, and there's a valve here called the ileocecal valve. All right, and it will dump, all right, food product into the cecum, and then from there, all right, the food will move up through the large intestine, through the ascending colon, over to the transverse colon, and down into the descending colon there. All right, so small intestine, also known as the small bowel. All right, it normally will take, which is I think an interesting number, 12 hours, all right, for food, all right, to make its way through the small intestine and for those nutrients to be kind of sucked out of whatever's in that area there. Primarily, again, we are going to see most of the nutrients be absorbed in this area here. And we're still going to see a lot of water leave that area, electrolytes and vitamins, those fat-soluble vitamins, all right, will occur here in the small intestine, right? So the first part of the small intestine is the duodenum. Now there's 4 parts to it, like I was saying before, all right? So this structure here, all right, the duodenum is going to be an immediate adjacent to the stomach, all right? And that chyme that is ejected from the stomach is going to enter into this area here, where then that's going to trigger the release, all right, because of those chemoreceptors are going to sense the chyme, and they're going to start to then release, all right, certain secretions, all right, that are going to trigger the accessory organs then to start emptying their contents from the gallbladder and the liver and the pancreas, all right, into the duodenum. Again, we'll talk more about those specifics when we get into the digestive system. All right, the second portion is the jejunum. All right, this is going to make up, all right, 2/5, all right, or roughly 40% of your small intestine. Again, we will see more chemical digestion occurring here, more nutrient absorption, all right, and so it's going to sit mainly over there on the left portion of your abdomen. And then the final portion here of the small intestine is going to be the ileum. All right, this ileum makes up about 60% of your small intestine, all right, and it terminates at the ileocecal valve, and this is that valve that is going to allow entry of certain food products into the cecum of the large intestine here, all right, and again, we're still going to see the absorption of that digestive material continuing in that area there. Now, in the small intestine, we have these small circular folds there, okay? And basically their job is to, one, slow the movement of, they act as a speed bump, but their job is to slow the movement of the food product through the small intestine, but it also helps to increase the surface area for digestion, all right? So these plicae circularis, these small little folds, and we'll see them here when we're labeling here shortly, all right, are made up of the mucosal and submucosal layers here of the small intestine, all right? Yes, they help to slow the movement down, but a big role for them is to increase, all right, the surface area, all right, to absorb a lot of that material, All right, and as we move, all right, through the small intestine, all right, we start to see them less frequently. All right, so they're quite numerous in the duodenum, but down in the ileum we don't see them as much. And then when they're in the large intestine, excuse me, we have a different internal anatomy altogether there. So if you look here at our picture, you can see out of our 4 layers, that inner layer, here's the plica circularis, how they just kind of act as a speed bump, but as food is getting pushed through, it kind of churns the food, right, and mixes it up, right, because we have a lot of these digestive enzymes here on the epithelial tissue here, all right, so we can increase that chemical absorption and breakdown there, okay? And so that the circular folds are made up of the mucosa and the submucosa. And then we have our muscularis. There's only 2 layers here, the inner circular layer, the outer longitudinal layer. So basically, we're not going to see the type of churning that we saw before when we were talking about the stomach. All right, in this situation, this is going to give us more of just that motility aspect of contraction, relaxation as we move, that process of peristalsis as we move the food products through, all right? And then finally, the outermost layer, that is our serosa or adventitia there. So looking at the inside, we have these small little projections, all right, from the mucosa. We call those villi, all right? And we'll see, all right, quite a bit of these in the jejunum, the middle layer there, or the middle section, excuse me, of the small intestine here. All right, but again, the purpose of the villi is to increase that surface area. All right, so we can absorb those nutrients. All right, and in these villi, we're going to see our blood vessels, our arterial, venule, and capillary network there. All right, because ideally, this is when we start to digest these materials. We want those materials to enter into the cells and then diffuse, all right, into our bloodstream, okay? At the same time, we'll also see our lymphatic presence here, all right, because we have what we call the lacteals, and these are going to be the lymphatic capillaries, all right, that are also going to be in the villi, all right, and their job is going to be the absorption of lipids and our lipid-soluble vitamins, all right, into our bloodstream now. Okay, well, eventually the lacteals will dump into the terminal chyli, sternochyli, excuse me, can't think today. All right, and then that's going to empty into your thoracic duct and whatnot. So here's a nice picture here of the small intestine. Okay, here you can see the villi here, all right, these circular folds. All right, and inside you have all of the epithelial tissue here. And then in our submucosa, this is where we're going to see a lot of the blood vessels, all right, including, all right, also including the lymphatic system here. All right, something that you may have remembered from chapter 5, all right, when we talked about the different types of epithelium here, all right, we have that simple columnar epithelium that lines the tissue. Okay, and we have the presence of goblet cells. Well, on top of those simple columnar cells, we have the microvilli, which are basically small extensions, and it's how the body, how the tissue is found a way on a cellular level to, again, to increase that surface area. All right, when we're looking at it under a microscope, it's been described as a brush border, but all it is these small invaginations of the plasma membrane, specialized modifications that help to improve and increase that surface area there. And on the microvilli, this is where we're going to have the brush border enzymes, which are going to help to break down those proteins, all right, some of the carbohydrates. All right, that's where we're going to see a lot of, you keep hearing me use the term chemical digestion. And like I said, we'll get into that in lecture, all right, but how that actually occurs, how we start to break down, all right, these specific macromolecules because of these brush border enzymes here. And then eventually, all right, we've got to get these macromolecules, all right, into the bloodstream. Well, this is where we're going to have these specialized proteins here, which will help to move, all right, those products into the bloodstream so we can actually move them into our circulation. All right. The goblet cells, we talked about that. That's the one that makes the mucin, which when added to water makes our mucosa, or excuse me, our mucus, which helps to, one, increase lubrication, all right, so we're not damaging, all right, but will also help to decrease the acidity of the chyme that's entered into that, all right. The intestinal glands here, all right, they're the ones that are going to help, again, to make some enzymes to help break down the food products in those regions, all right. And then you're going to find, all right, in these tissues, all right, we have several different structures, all right. For example, let me go back here. All right, when we talk about, look, intestinal glands, goblet cells, all right, the unicellular glands, the enteroendocrine cells, and the submucosal glands. Point being is, you're going to see all these different structures, all right, in these villi, and they all have an individual role. And we'll get into, you know, when we're talking about the breaking down of proteins, because proteins are a real pain in the rear end, all right, and they take a lot of work to break down. So we have to start the process of protein digestion up in the mouth, all right, continue it with the stomach. Thank goodness for hydrochloric acid, which really busts up those proteins, because proteins can be several hundreds of amino acids long, right? So we need to start somewhere. And so we'll see the value of that later on. The enteroendocrine cells, these are the ones that are going to produce, all right, two of our hormones that play a major role in regulation of, one, the motility of the small intestine, but also the motility of the stomach and, all right, the secretions of the stomach. We saw that CCK and the secretin there will have almost like a negative feedback, all right, characteristic on the secretions of the stomach and the motility of the stomach. And then finally, the submucosal gland, huge role here, all right, because remember, stomach acid is pretty acidic. It has a pH value of close to 1, okay? Well, that's enough to burn a hole in these tabletops that you're sitting at, okay? So we need to figure out a way to neutralize, all right, that stomach acid. Well, your body's done that with the submucosal gland, okay? It produces this alkaline, which is a basic type of product, that mucus, which is going to be found in the lumen there of the small intestine, so it can actually neutralize the acidic properties of the chyme, so it protects the duodenum and prevents you from burning a hole in yourself. So we'll go, again, like I said, we'll go through this in lecture, we'll break it down, but you can see all these different glands and where they're present here, all right, and the role that they play. But the big thing I want you to understand is, all right, your food products will be out here, all right, they'll start to undergo that chemical process and the chemical digestion breakdown, and then we can actually bring those the nutrients across the epithelium and then here into our bloodstream, all right, and it can diffuse into the capillary bed and the lacteals and move into circulation and then circulate throughout the body. Okay, you can see not too far off. We have a lymphatic nodule here too, so we have our immune system on hand in case anything tries to cross over this epithelial barrier here. We have a way to prevent that. All right, so here you can see as we move into the lower GI tract here, here's the duodenum, okay? Right here, stomach, the first part of the small intestine, the duodenum here, and then you can see there's these little ridge-like structures. Those are those circular folds we were talking about, and those are the plicae circularis here. All right, then we move here in this region here of our small intestine over on the left side, all right, that is the jejunum, right over through this area. Over here, all right, closer to the beginning of the large intestine, that's going to be the ileum. Okay, and then you've got your, on the right side here, you've got your ascending colon, your transverse colon, then the descending colon. All right, and you can see that this right here, this outpouching here, that's called a haustra. All right, and it's just this little kind of sac-like structure here. And you see that there's plenty of them. And you see this little line here, that's called the tinea coli. That's a smooth muscle. You can see it right through here too. All right, that is smooth muscle tissue there. All right, and that is one way to help move food through here, but it also, that Taenia coli helps to create these haustra, these outpouchings here. I know. I wish I could tell you some of the, well, plique, I think that's Greek. It's all Greek to me. All right, so here you can see as we go through, all right, the lower portion of the lower GI, all right, this arrow is pointing to the ileocecal valve where the ileum transitions, all right, into the cecum here. All right, this valve again, most of the time it's closed, but when it's open, then that will allow the passage of the food product here into the cecum. Vermiform appendix, right here coming off of the cecum, this big outpouching here. All right, then as we move up on the right side here, this is going to be the ascending colon, and it comes to this first curvature here. And this first curvature here is known as the right colic flexure or the hepatic flexure. Called the hepatic flexure because that's the side the liver's on. Then we cross from the right side of the body over to the left side of the body, all right, here in the transverse colon. And then we come to another flexure. And this is the left colic flexure or the splenic flexure because the spleen is just above that. Okay, then the colon takes a move downwards. That's the descending colon. And then it kind of swings back inwards towards the center line of the body. All right, and that's going to be the sigmoid colon. And the sigmoid colon connects here to the rectum. It's a major storage site for a lot of the feces collection until it's time to go to the bathroom. And then the final portion here of the digestive system is going to be the anus. And you have two sphincters involved with the anus, okay? One that's primarily made up of smooth muscle tissue, all right? And that's going to be the internal anal sphincter. And then you've got the other one made up of skeletal muscle tissue. That's the one that you learn to control when you are undergoing potty training, and that's going to be the external anal sphincter. All right, let me just talk about the liver here for a few moments, then I'll let you guys go. All right, so the liver, it is an accessory digestive organ, okay, located in the right upper quadrant of the abdomen, okay, just below the diaphragm there. All right, when we're talking about its digestive functions, primarily produces bile. All right, so bile is going to help us to break down these fats. All right, the liver is covered by a capsule. We've seen in previous chapters, we've talked about various capsules of the kidney. Well, we haven't really talked about the kidney, but for the adrenal gland or for a lymph node. All right, these capsules have a way of invaginating down into the actual tissue of whatever that organ or anatomical structure is. All right, and when it does that, all right, it breaks up the internal components of that organ, all right, into little sections, all right, and that's what we're going to see here. We're going to see this capsule, all right, it covers the outside of the liver except for one area where the liver makes direct contact with the diaphragm, all right, and I'll show you that in a second here, okay. All right, so the liver has 4 lobes. All right, primarily the 2 largest lobes are the right and left hepatic lobes, okay? And then the right lobe, all right, has 2 smaller components to that, okay? And so what separates the right and left lobe is the falciform ligament, which is this guy right here. All right, this is the here's the right lobe, here's the left lobe, all right? And so those 2 lobes are separated by the falciform ligament. And the falciform ligament, all right, it attaches anteriorly onto the anterior portion of the abdominal wall there. But you can see here at the bottom of the falciform ligament, at the free end of it, that's the round ligament of the liver. All right, the round ligament of the liver. All right, we don't really talk about embryology too much in this class. All right, but when you're developing inside of mommy before you're born, all right, the round ligament of the liver at one point was a blood vessel, and it housed, all right, the fetal umbilical vein. But once you're born, that goes away, okay? All right, so like I said, there's 4 lobes to the liver, all right, and the 2 major ones are the right and left. Well, in the right lobe, we have the quadrate and the caudate lobes. Now, how to remember which is which? Caudate begins with the C, and it's right next to the inferior vena cava, and cava begins with the C. All right, and then the quadrate lobe is going to be immediately adjacent to the gallbladder. Those are best seen on the inferior posterior view. All right. A couple other structures that you need to be familiar with, obviously inferior vena cava. All right, we have another structure that when you're born, all right, turns into a ligament. This is called the ductus venosus. All right, and again, once you're born, and the production of certain chemicals in your body will cause this structure to degenerate into a ligament structure here. And then where all the blood vessels and lymphatic vessels, all right, nerves and everything, all right, enter and exit the liver, we refer to that region as the porta hepatis. All right, so here you saw in the anterior view here, okay, you can see the right lobe, the left lobe, top portion of the inferior vena cava. All right, both of these lobes are separated by the falciform ligament here. At the bottom of the falciform ligament on the free end there is the round ligament of the liver. Gallbladder is peeking out there underneath the right lobe. We look at it from the inferior posterior view here, and you can see, all right, this big lobe, that's the right lobe. Here's the left lobe, but then we have a couple smaller lobes. The lobe that's adjacent to the gallbladder is the quadrate lobe. All right, that's going to be more anterior there. And then the caudate lobe is going to be more to the posterior portion, all right, and that's going to be adjacent to the inferior vena cava here. And you can see right along the inferior portion here, okay, you can see we have the ligamentum venosum. And again, at one point, this was actually a blood vessel, right, during fetal development. And then this area here where it looks like all these blood vessels are entering and exiting the liver, all right, that's the porta hepatis. That's where we're going to see, all right, several structures. So you can see it here on your model here, okay, gallbladder. All right, we're looking here at the right hepatic lobe. Here's the left hepatic lobe. All right, and the structure that separates the two, all right, that's the falciform ligament here, all right, underneath. You got your inferior vena cava, all right, and then another structure here is called the coronary ligament. Coronary is another name for crown here. All right, and that's going to be more towards the posterior portion, all right, of the liver. All right, I'm going to stop there. I think this is a good place to stop. I know that people's brains are fried, and then we will pick up with this on Wednesday.